The irony is, as doctors learn more about cannabis and once again become familiar with its use, it makes your life much less difficult as a doctor because it gives you another tool in your toolbox. When we're trying to treat conditions such as insomnia or chronic pain or anxiety, very difficult. And the medications that we use not only don't work all the time, but they can have very heavy side effects. Take, for example, chronic pain. Now, we could treat chronic pain with opiates, but we did that before, and that was a complete disaster with tons of people addicted to opiates, people overdosing, and a lot of people just stuck on them that don't really need them. And opiates don't really work well for chronic pain. We could use non-steroidals, but people take ibuprofen after ibuprofen. They take naproxen after naproxen, naproxen, Aleve, diclofenac, and they slowly destroy their kidneys. I see so much kidney damage that could have been avoided, for example, if we used small doses of cannabis instead of non-steroidals over and over and over again. Also, not to mention non-steroidals cause gastritis, bleeding, and they cause about 10,000 heart attacks a year. We could treat chronic pain with Tylenol. The problem is Tylenol doesn't do anything. So as a doctor, it makes your life a lot easier to have cannabis in your toolbox to treat chronic pain because especially at low doses, you work your way up, you start low, you go slow. You don't just focus on THC, you can focus on some of the other cannabinoids such as CBD or CBG, which help with pain. And then you can get people, most people, not everybody, very comfortable on a low dose. The side effect is a little bit of euphoria. Cannabis can be addictive. That's a topic for another day, but it's not as addictive as many of the other drugs we'd use, such as opiates or benzodiazepines. It's certainly not as addictive as alcohol. And so it's really important for doctors to get comfortable using cannabis again because, again, the patients are way ahead of the doctors. The patients never stopped using medical cannabis during the 70 years that the doctors were busy being on the wrong side of the war on drugs. And the patients find it invaluable for nausea, for vomiting, for chemotherapy, for multiple sclerosis, for anxiety, for insomnia, and for chronic pain. So doctors need to meet patients where they are. They need to be able to speak comfortably and clearly with patients about cannabis. And patients need to come to doctors and be able to feel that they could discuss their medical cannabis use without stigma, judgment, or punishment. This is true, by the way, for all drugs and for alcohol. The more comfortable a doctor and a patient are discussing this, you could save lives. So really important for doctors to get up to speed on cannabis, really important for them to be able to speak to their patients about cannabis, and really important for us to understand that cannabis is an important tool in our toolbox, not a cure-all, not for everybody, but that it really can make life better for doctors and patients alike. Thank you.